This is our first Wellness Grand Round of the year. What we're trying to do with our program is create interdisciplinary opportunities for students, faculty and staff across campus to engage in information, practice, and policies, both in their profession as well as within their careers, and also with things dealing with the Baltimore community. So we have over 50 events planned for this academic year, anything from environmental sustainability to geriatrics, which Dr. McMillan will talk about today. You can check out all the information online at wellness.umaryland.edu. We appreciate if you could fill out the evaluation at the end of this program so we can see how we're doing, make improvements, see what you're interested in us to be able to provide in the future, la-di-da-di-da. And with that, you're not here to hear me speak, you're here to see Dr. McMillan, so I'll pass it off to him.
All right. Thank you, Hillary. I'm going to give a little background about myself, but I want to learn who you are as well. I teach at the School of Social Work, and I've been there since July of 2006. And I actually have a long sort of work career in terms of aging and health. I actually started off my career as a social worker prior to my MSW, working for the state of Indiana in what's called AFDC, which is now called TANF, which is Public Assistance for Families. And at the time, the feds wanted the states to be sure that people were not getting services inappropriately. So I was a quality control reviewer, reviewed cases, made sure they met the guidelines, et cetera. And it was a good sort of training ground to learn about how to interview people, get some collateral information, because I had a bachelor's degree in psychology, and it wasn't a clinical program in any kind of way. So, you know, it was all in the classroom. So I had no practical skills at all. And I did that for a while, and then I was working in a situation reviewing a case with a woman, and she said, I really hate your intrusive questions. And she said, what I want someone to help me get off welfare. And she said, nobody's helping me. And that really, it hit home, because I realized that wasn't my job. And I thought, I mean, it was a paycheck in some ways, it was a good skill sort of piece, but I reached a point, it's like, well, I want to help people too. And it had been that I'd actually taken a lateral transfer in Indiana, and I remember as I drove into the city the first time to look at it, drove past the hospital, and I thought, I wouldn't mind working there. And from there, I thought, that's time to go. So I followed up, and sure enough, they had a position, and I was hired as a discharge planner. And that was in the mid-'70s. And hospitals were just beginning to hire social workers to assist people, primarily people on Medicare, to help them make plans to leave the hospital. And I remember working that job for a while. The first 6 months, I thought, I'm going to have to talk to all these older adults about their Medicare benefits and how to get services. And maybe in a year or so, I'm going to have talked myself out of a job. Well, needless to say, I was there 11 years, and the department still functions. And what I learned is that sometimes people, they know they're growing older, they may have some needs, but they do have a tendency to sort of wait till they need things. And there's a lot of controversy about that sometimes. It's like, well, should they plan better, et cetera? But sometimes you can't plan about what's going to happen in old age. There's some things we can make some adjustments for, but we can't always know. And so from there, I got thinking, especially as I worked with some folks who said, I'll be fine, I'll make it. It's like, how do you know that? And they were convinced, and from a healthcare team perspective, it's like, well, things aren't perfect, it's not really safe. But I realized that older adults really did have some sense about themselves that we had to trust. And for many years, that just sort of led into more questions and eventually a PhD. And so that's what I want to talk about, is some of that journey a little bit. And so in preparing for this and talking about it, it's like I want to share some of my thoughts and ideas and also sort of engage in some conversation.